What are your options if you lose your teeth? So what happens if you lose your teeth? No, really, what's the next steps? I've got three options for you, and today I'll make sure to explain them out, but also to help them make sense for you. So let's go ahead and get right into it. Have you ever tried finishing a puzzle with just one piece missing? Looks fine from far away, but close up, it bugs the heck out of you, right? A missing tooth is just like that. One gap may not seem urgent, but over time it affects the whole picture. So that's what we're here to talk about. We're here to talk about why replacing teeth is so important. So, teeth next to a space can shift. The bone underneath typically resorbs when you lose a teeth. And then this also changes your bite. One of the other things about losing teeth that people don't really know is it can affect the way that you speak. So you may start to speak with a lisp or make more emphasis on your F's and your S's and your P's. So some of the options, let's go ahead and jump right into it. So option one, we got to jump into the implants. I think everybody thinks that they're candidates for the implants. And pretty much what happens with implants is it's a surgically placed prosthetic that's fused to your bone. My patients share with me that it feels like a natural tooth and it doesn't affect the other teeth. The other thing that I really like about implants are there's about a 95 to 98% success rate over 10 years. Option two, this one is bridges. Crown and bridges, this is pretty much anchoring the neighboring teeth to close the space. This is great when you have adjacent teeth that already have large fillings or cavities on them. So it looks natural and it's fixed, meaning that you can't take it in and out. The downside to this is that you actually have to remove a good amount of tooth structure in order to have this particular option. Option three, removable partial dentures, or we call them RPDs or partials. This is the least expensive option. And this is something that is removable so you can take it in and out of your mouth and replaces one or more teeth. So if you have several gaps or several teeth that are missing inside of your mouth, this is a good option. Now, one of the downsides that patients share is sometimes it can feel a little bit bulky and the stability sometimes can be off, especially if you have certain types. So there's three different types. There's a flex one, there's an acrylic one, and then there's also a metal one too as well. I'll make another video to actually discuss all of those, but I wanted to kind of give you guys a general sense if you're losing or missing teeth. Now, my question to you guys is, if you had to choose tomorrow, whether it will be an implant, a bridge, or a partial, which one would you go for? Drop it in the comments below. So I wanted to also give you guys something for you to consider. Tips to actually help you choose which option is best for you. Your health and your bone availability is a big portion to why you can kind of determine which one you want. You also want to consider your budget. You also want to consider the amount of teeth that you're missing. Another thing that you want to consider is whether you want something to be fixed, meaning that it's going to stay there and you can't lose it, or removable. You're okay with it coming in and out at night. Now, one of the things that I really want to share with you guys is a pro tip for real. You really, if you lost teeth, you really don't want to wait too long because one, the bone shrinks faster after an extraction. You don't want to wait too long because it can really affect what option you can do. So let's go ahead and jump into a quick recap. One, you don't leave missing teeth unaddressed. It really leads to other problems. The other thing that I want you guys to know is we have great options. We got implants, we got bridges, and we got partials. I would also encourage you guys to talk to your dentist about timing, cost, and long-term health with these options. So what's next? YouTube is going to actually tell you guys what video is best. They'll probably put them up one of these areas right here. I talk about gum disease, I talk about infections, I talk about tooth loss. So hopefully you'll find a video that helps you and supports you in your dental journey. Again, it's been an honor. You guys be blessed. I'll talk to you real soon.